This is Dr. Jared Eames, one of the family medicine physicians in the 8th Medical Group's Warrior Medicine Clinic from the 2020 to 2021 class here at Kunsan. I have been asked to prepare this brief to lay out some of the roles and responsibilities of the 8th Medical Group and to provide you with the information you will need to navigate your healthcare while here in Korea. Though this presentation is a video, it will require some interaction on your part. Important information will be presented that you should have with you in order to access the care you will need. Get your phones out and have them ready. When you see this image and hear this noise, be sure to take a picture of the slide so you can access the information in future. The first thing you need to know is that the 8th Medical Group is designated to provide medical care for active duty members only. Visiting family or friends will have to seek care off base. I highly recommend purchasing international travelers insurance. If your visitors are TRICARE beneficiaries, they can utilize the TRICARE Overseas program for compensation for medical care. However, be aware that they will be required to pay out of pocket first and then apply for reimbursement. The 8th Medical Group is not involved in arranging any medical care for anyone who is not an active duty member assigned to Kunsan. Here is the first piece of information you should keep for your records. Be aware that this is an outpatient clinic. We are open only during the week and typically close on wing down days, such as training days, and during holidays. Minimal services are available during base exercises. Please go ahead and take a picture. And here are some maps to help you navigate the med group. We are located on the north end of the base, right across from the Wolfpack Lodge, in the opposite direction of the flight line. This is the layout of the main clinic building, where most services are located. Note that the entrance is located at what appears to be the back of the building if you are coming from the Wolfpack Lodge. The first med group service I would like to discuss is the Warrior Medicine Clinic. Our flight's vision is to keep our military medically fit and mission capable, and our mission is to oversee and support all aspects of the health of the service members in order to support our airmen and the mission by maintaining readiness for medical response, providing EMS oversight, granting medical program supervision, and giving our members outpatient care. An important role we play at this facility that many service members are not aware of is supervision of the many medical programs in the medical group and on the base. Our providers and staff all carry a number of roles that are essential to both ensure that our members are well cared for and to support the mission, and we work hard to ensure the safety of the service members. These roles are vital to the everyday function of this group and the base. Next, one of our most important roles here is providing medical supervision for ambulance services. Our ambulance services provide primary and secondary coverage for 24 hours a day, 365 days a year here, and one of our providers is on call at all times to provide medical oversight. All ambulance transports require approval from a provider. Furthermore, our technicians also provide backup coverage for our ambulance. Here at Kunsan, we are a very small medical group. As I mentioned before, we have very few providers, so we are only able to provide a limited number of patient encounters each day, and those only during business hours. Furthermore, we are an outpatient clinic, aimed at overseeing your long-term health, and therefore we don't have the resources you would find in a hospital or emergency room. For these reasons, we depend heavily on the local community to provide both emergency medical coverage and urgent medical care. Our base has established relationships with 2 medical centers in the local area. Kunsan Medical Center is located about 15 to 20 minutes from the base and has an ED where you can be seen for both urgent care type visits like muscle sprains or upper respiratory infections and for more serious medical emergencies. Wangkwang Medical Center is the nearest university medical center and trauma center. It is located about 30 to 45 minutes from the base and has access to more advanced specialty care. Both of these medical centers provide 24-hour access. Our base has established relationships with these hospitals, and they will provide translators and English written materials whenever possible. But please be patient and courteous while you are there. Remember, we are guests in this country. Here are some important phone numbers for you to keep with you. The first 2 numbers are the numbers for the translators at the Kunsan and Wangkwang medical centers. However, be aware that these translators are contracted by these hospitals and are not always available. The phone number marked in red, however, is the number for International SOS, which is the translator service contracted by the military. You should keep this number on hand and can always use this number when in need of a translator for your medical care. In case of emergency, and we define emergency as threat to life, limb, or eyesight, it is imperative that you call 911 immediately. Remember that if you are calling from a Korean cell phone, the number is 063-470-0911. From a DSN, the number is just like in the United States, just 911. Like in the United States, emergency services must be kept available to respond in case of real medical emergencies. For this reason, it is not safe for our base population for our ambulance crew to transport non-emergent medical patients. This means that if you need to be seen off base, but are not experiencing a threat to life, limb, or eyesight, you will need to provide your own transportation to either Wongkwang or Gunsan Medical Center. This is not at all unlike the process you would follow if you were back home in the United States. Please don't hesitate to contact your leadership to see if a ride can be arranged. If needed, you can also call a taxi, or even ask a friend for a ride. We all need to be wingmen and women for one another and do our best to help each other when we see each other in need. Our final role is providing our active duty members with outpatient care. First off, it's important for you to understand a bit about how this clinic operates. In order to optimize access to care, DHA mandates that we provide a set number of available appointments each week. While in ideal circumstances, this makes it a bit easier for patients to schedule appointments to be seen, it also leads to limitations in the appointments themselves. In order to meet the required number of appointments, we are only able to allocate 20 minutes per patient. Included in this 20-minute slot is the time we need to spend discussing your concerns, provide any interventions, and also document the entire encounter so that your care can be coordinated in the future. Every appointment is important, so the course of our patient care time is strictly regimented with little to no flexibility. If any patient shows up late, it will impact the subsequent appointment times for all of the patients who come after, leaving them waiting to be seen beyond the times they were scheduled, and can even cut into the time that would have been set aside for them. We value the time you have set aside for your health care, so we work hard to try to keep this from happening. For this reason, we ask you to please help us to help you. Please do your best to check in at least 10 minutes before your appointment time. We will do our best to work you in early if it is at all possible. Out of consideration for all of our patients, we have a strict on-time policy, so if you are more than 10 minutes late for your appointment, it will have to be rescheduled. If you think you won't make it in time, please call in advance, and we will do what we can to accommodate your situation. During your encounter, we will likely not have time to safely address more than 2 concerns. Trying to cram in more than that often only leads to mistakes and does not allow us to give your concerns the time that it deserves. Finally, we have members who drive 2 hours or more to make it to an appointment, and who have to wait months to be seen, so please be considerate of other patients' time. While we can't guarantee it for everyone who may need it, we work hard to provide acute care access whenever we can. We set aside a number of appointment slots every day that are supposed to be made available only 24 hours in advance, so that you have the chance to see a provider same day. We also work with the IDMTs in flight medicine to make appointments available in which you can be seen by a specially trained technician under the oversight of a physician. This here is called sick call. However, please be aware that there are many urgent medical conditions that we cannot manage here, and we have limited number of appointments, so you may need to be sent off base for your care. Other important services to be aware of are walk-ins and TCONs. For situations that do not necessarily require a provider, we try to provide access to walk-in appointments with a technician who can do blood pressure checks, remove sutures, manage simple UTIs, among many other things. You can also leave a message for your PCM through the appointment line by asking to leave a TCON. We will try to get back to you within 72 hours through a nurse or technician, but be aware that we may determine that an appointment is required to resolve your concern. Next, I would like to provide you with some information from the public health flight. But before I get started, I would just like to quickly remind you, even though I know there are signs everywhere saying it, if you are experiencing COVID symptoms such as cough, fever, shortness of breath, or loss of taste or smell, please go directly home and avoid coming into contact with others. During business hours, you can call the COVID symptom line at 010-3658-0752 for guidance. Please, if you encounter any of your colleagues who need this information, be sure and pass it on to them. You should be aware that public health works hard in the background to help prevent illness and injury on the base, and they provide a variety of services to help accomplish this. In particular, you should contact them before international travel to receive guidance on potential health risks, as well as to make sure you have the appropriate vaccinations. Also, they provide a walk-in hearing screen service that is available during business hours. Now let's talk about the Exemption Family Member Program. This service exists to ensure that the Air Force can provide adequate care to your family members when they PCS to a new location. If you have dependents, you must contact the EFMP office 6 months before your DROs to coordinate their care. Please keep this slide. Next, I'd like to touch on some information from immunizations. Here at Kunsan, we have been given and are administering vaccine against COVID-19. If you have not been vaccinated against COVID, we are scheduling vaccinations every Friday afternoon. Please call the appointment line at this number to schedule. If you have a group, you can arrange vaccination at the immunizations clinic any day of the week during business hours. We recommend calling immunizations in advance for coordination. Now we will talk about the pharmacy here at Kunsan. If you are experiencing symptoms like allergies, poor sleep, or heartburn that can likely be managed with over-the-counter medications, you can stop by the pharmacy and request a form for their SICK program. Just fill in your symptoms and give it to the pharmacist, who will dispense over-the-counter medications to help you with your complaint. Our pharmacy also has a program for dispensing Plan B, emergency contraception. You should know that this should be taken within 72 hours of unprotected intercourse. This medication can be obtained from the pharmacy during their normal business hours and does not require a scheduled appointment. You are not permitted to use either of these services if you are a flyer, PRP, or armed use of force. Also, if you are running low on a prescription medication and are unable to get an appointment with a provider before your medication will run out, you can stop by the pharmacy and request a gap fill. You just have to have an appointment scheduled already, and the pharmacy will provide enough medication to last until that appointment. However, this service is not available for controlled substances. Now we will touch on the flight medicine clinic. Our flight medicine team would like to remind you that it is your responsibility to stay on top of your IMR status. Please be sure to check your IMR status regularly to ensure that you are fully mission capable. Here is the website you need to do so. Finally, I'm going to talk about our local TRICARE office. First off, if you are active duty with orders to Kunsan for 180 days or more, you must enroll with our local TRICARE. Through this process, you will be assigned a PCM and will be given access to our clinic services. You can always speak with our local TRICARE representative during business hours at this phone number or at their office, which is located in room 1207 in the main clinic building, number 405. Here's another slide with information that you should keep with you. Don't forget that your dependents must be enrolled in DEERS in order to take advantage of TRICARE benefits. Also, if you ever need to seek care at a civilian emergency department, make sure you contact TRICARE within 2 business days. Another resource to be aware of is TRICARE Online. If any exams are ordered during your encounter today, you can get the results on TRICARE Online. You just have to set up your patient portal. Be aware that we often have to ship out our labs, so results may take up to 6 weeks to come back. There are many other resources available on TRICARE Online as well. You can book appointments, view prescriptions, and even use the secure messaging. Here's one final important note for you to keep. Documentation from nearly all off-base encounters should be sent by the provider to the clinic and are typically received within 3 to 5 business days. It is highly recommended that you schedule an appointment with one of us providers after you are seen so we can assure that your care is being appropriately coordinated. This is especially important if you are seen in the emergency room or admitted to the hospital. Off-base providers are not able to arrange profiles, quarters, or con leave. If you schedule your appointment after these 3 to 5 days, we can also review their documentation with you and help to clarify any concerns. This concludes this informational brief. It is our honor and privilege to provide your medical care. If you have any questions on the roles, functions, or flow of our clinic, please don't hesitate to ask.